Hi, this module is Integrating Clinical and Career Services. It was originally developed by the Integrated Employment Institute and presented in partnership with Oaks Integrated Care. Let's look at the objectives for this module's training. There are three main objectives. One is identifying common clinical outcomes related to employment goals. The second objective is understanding and demonstrating practice guidelines for clinicians to improve their support of individuals pursuing employment and career goals. The third objective for this module is examining current agency practices that support employment goals for individuals participating in your services. You may have already reviewed the role that work plays in recovery, whether as a main goal or the means to another personally meaningful goal. There is much research highlighting the achievement of clinical goals and improved clinical outcomes through pursuing and attaining valued life roles, including those related to being a worker or a student. And because our clinical outcomes are usually related to our programmatic goals, we know that vocational development is the job of everyone on the team, not just the vocational specialist or others in a designated employment support role, because it really does impact wellness, mental health, and substance use. Many of you have already viewed the module on employment readiness, where you were introduced to the factors associated with change. This included the things that hold us back from goal-directed change and the role of ambivalence in that process. You were also introduced previously to the spirit of motivational interviewing as it relates to supporting recovery and the process of change. This training module will be using that information to begin to develop strategies to increase readiness for change, and we will demonstrate how all team members can play an important role in that journey. Before we move on to those specific strategies for increasing readiness, I would like to take a step back and review the four factors. And remember, readiness is an interest or a willingness to engage in the process of change. It has nothing to do with one's ability. Let's look at felt need really quickly. Felt need is comprised of one's willingness to work toward a goal, how dissatisfied the person is with their current experience or role, and that person's motivation. When we look at commitment to change, we're really looking at someone's belief that change is both possible and that change would be positive. So in this instance, we're talking about career pursuits and that person's belief that pursuing employment or pursuing returning to school would be both possible and positive to them. The person's external awareness is really the knowledge of the environment they're seeking to be part of. Again, for our purposes here, we're really looking at those career environments. We're really looking at including expectations and requirements of the job or educational program, and the person's internal awareness, the knowledge of themselves in their desired role, including that of worker or that of student. And internal awareness includes really examining interests, values, and preferences that relate to employment and education. We also don't want to forget the importance of the Therapeutic Alliance and that relationship that you have with the person, the importance of developing and nurturing a therapeutic alliance with someone. So consider a person that you're working with on an employment goal. Now, ask yourself some of these questions. What statements have they made that allude to felt need, that feeling of urgency or dissatisfaction? Think about past conversations that you've had with individuals and think about those indicators that you've noticed in terms of what are some indicators of high readiness? What are some indicators of possibly low readiness in each of these areas as we go through? What statements have they made that allude to commitment, belief that it's possible and positive? Have individuals made statements that allude to external knowledge? Do they know what the expectations or requirements of the environment might be? And finally, what statements have they made that allude to internal knowledge? Does the person know what their interests are as related to work, what their values are as related to work, and what their preferences are? So now that we're starting to recognize these factors, we want to use that spirit of MI, that spirit of motivational interviewing that you were introduced to in previous modules to guide our conversations, to deeply explore these areas with individuals. We want to allow the person to identify what is personally meaningful to them, what they perceive to be pros and cons of changing, and the pros and cons of staying the same, and understanding that ambivalence is part of that process. And the reason we're doing this is to get a better understanding of the skills, knowledge, and resources the job seeker or individual seeking to go back to school may need in order to work toward achieving that goal. It allows us to develop individualized interventions that might leverage one's strengths while targeting the person's fears, barriers, and needs. Every person on the team can share the message that employment and education are part of the recovery process and support people in working toward change. Nearly 3 decades of research tells us it is best practice to have vocational services integrated into clinical teams. At one point, this was a novel idea. Are any of you on PAC teams? This was one of the first truly integrated service models. And when you look at the history of supported employment, you'll see that coordinated services is one of the principles of the individual placement and support model of supported employment, which is the evidence-based practice. Back in the late 90s, a set of best practice guidelines was published to provide mental health programs with guidance on how to integrate clinical and vocational services. Let's take a quick look at these as they remain very relevant even today. But first, let's look at why integrated services. Why are integrated services so important and critical? Research has shown that there are lower dropout rates. There's better communication between clinical and employment staff. Individuals are provided with consistent messages. And clinicians get involved in supporting employment goals. Therefore, clinical information gets into the employment plan. This is an older reference, but the message still resonates today. These authors identified 9 practice guidelines that support the integration of clinical and employment or non-vocational services. Let's go through the practice guidelines, and then we'll talk about each of these in detail. The first 4 are looking at providers can help support change. Providers can coordinate the individual's clinical and rehabilitation plans and interventions. Providers can provide basic support and problem solving. Providers can contribute insight into appropriate job matches that will support illness management as well as vocational needs. Providers can help individuals manage their illnesses. Providers can also help individuals manage substance use. Providers can assist with interpersonal issues on the job and facilitate interactions with supports and social networks, whether that's on or off the job, and also help support an individual's long-term career efforts by remaining positive. Now that we've introduced these 9 items, let's go back to readiness development. We're going to spend a few minutes discussing strategies for developing readiness in the areas of need, commitment, internal and external awareness. And we're going to use these guidelines as a framework for doing so. Readiness in the areas of need, commitment, internal knowledge, and external knowledge can be developed and increased through exposure to new information, through new experiences, increased understanding of options, insights gained from past experiences, and shared observations. As we walk through the practice guidelines that we just introduced you to, consider how you, in your unique role on the team, can play a part in doing this. Clinical understanding helps individuals to see work in a broader context of life and recovery. Providers can support change efforts. Some people may have been in the mental health system for a very long time and they can't imagine themselves as a worker or a student. Providers, all team members, can really help individuals highlight and identify what their strengths are. How are those strengths or skills transferable to work or school? Providers can also emphasize therapeutic elements of work and the role that work plays in the recovery process. So as providers, we can really highlight and underscore those therapeutic elements of work and how work does contribute to the recovery process. Providers can also support people to grieve or mourn losses that they may have encountered. They can help individuals build strengths and address what needs. Ideally, support people or providers can assist individuals to address issues related to medication or side effects from medication and support people in working with their psychiatrists to address these. Think about what else providers can do to support readiness development in this area. How can someone assist in change efforts? Oftentimes, people may just need someone to talk with and to share what their dreams and goals and plans might be. Providers can coordinate the individual's clinical and rehabilitation plans and interventions. Sending a unified message of support is important and critical to the person's attainment of employment and education goals. When providers, such as psychiatrists, other treatment team members, nurses, case managers, express enthusiasm for the person's interests and abilities, it increases someone's motivation and interest to work, and the person's belief in their own capacity to return to work or school. People often rely on the treatment team's belief that they can work or go back to school. Oftentimes, individuals can sense a provider's confidence or anxiety about the benefits or potential hazards of working. Coordinated plan of action and interventions is critical. Sometimes ambivalence is expressed by reporting different views to the clinician and the vocational specialist. Plans should be streamlined to cover the rehabilitation goal and the essential steps in getting there. Again, think about your role on the team and how can you help coordinate the clinical and rehabilitation / career plans and interventions. What role can you play? Providers can provide basic support and problem solving to individuals receiving services and to other team members. Think about what types of support you can provide in terms of problem solving if individuals are considering going back to school or work. You can help brainstorm and identify solutions to a problem, and helping that person better understand the role that work plays to possibly enhance their level of satisfaction and sense of self. For example, you might be able to help with decisions regarding negotiating public transportation. The vocational specialist on your team may provide transportation training or help the person connect to transportation training. Maybe the clinical member or the non-vocational staff person can work with the person on mindfulness strategies to reduce any anxiety or cognitive remediation strategies to help with planning and assist with prioritizing or whatever that might be. But use all of the expertise on the team to really support the person in their career goals. Providers can contribute insight to appropriate job matches that will support illness management as well as vocational needs. Providers can assist with helping someone really look at what are the person's interests, what are the person's values, what's important to them. Does the person enjoy working alone? Is the person working alone? Is it desirable? Or does the person have heightened symptoms in certain environments? For others, the person might need to be with other people. So having those conversations with the individual job seeker or person interested in going back to school to really help sort through what some of the best job matches might be for the person. The hours of a job may impact a person's illness management. The hours of a job may prevent adequate sleep and therefore increase certain symptoms. So having these discussions with the clinical members of the team to really support the person's attainment. So rather than thinking, well, this isn't going to work because the hours are in the evening, have some frank, honest, and open discussions about what will the person do to manage it. Could the person address medication side effect issues with a psychiatrist? Another example might be some people preferring quiet environments to think clearly and stay focused. Other individuals might need to wear a headset to drown out potential symptoms that they may be experiencing. So as a provider, a non-vocational or clinical provider, you can really contribute your expertise and insight to help with the job matching process. You as a clinical team member or non-vocational provider on the team can also help someone manage their illnesses, helping someone develop a wellness recovery action plan, which is developed by Mary Ellen Copeland. And there are resources in this presentation at the end to help you develop a wellness plan with someone, identifying what some of their potential support needs might be and what types of resources and supports the person has in place, or you might be able to assist them in putting into place to help mitigate some of the challenges that they may be experiencing due to the illness or even side effects from medications. You really want to help someone develop strategies to manage symptoms and to negotiate needed medication adjustments, maybe help the person negotiate with the psychiatrist or the nurse. You may need to help the person negotiate or better understand adjusting the timing of medication to make sure there's an optimal fit between the daily rhythms and the demands of the work and symptom management. Providers can help individuals manage their substance use. Working plays a role in recovery from substance use. Oftentimes, employment provides structure, a competing alternative activity to using substances. However, work may present some risks that need to be addressed. Someone with extra cash might be a trigger for some individuals. For some people, it may not be. Helping the person manage and develop a plan for managing extra income is important, but always be mindful that that income is the person's, and we want to be very respectful, but helping that person plan for how they may manage any extra income that might be coming in. There might be new social interactions that may present opportunities for the person to relapse. Some employment settings have happy hours or other types of social events or activities that the person is going out, and there may be opportunities for relapse that you as providers may want to help the person address. You can coach and role play problem situations with someone. So if someone is having a difficult time interacting on the job with a coworker, or if someone has a hard time saying no to overtime to their boss, you can help coach them through that situation and also help them identify other supports for maintaining sobriety in particular. What are those outside resources that the person may need to access? Working collaboratively with the person and the vocational specialist, if there's a vocational specialist on the team, to develop support plans and to identify strategies for coping with triggers, but also to identify job matches and work cultures that may enhance sobriety is often critical and key at this point. Many individuals may not have been working for a while and may need some support around interpersonal issues or communication on the job. Clinical providers or non-vocational providers can help with that. Many times, if someone hasn't worked for a number of years, they may not be used to interacting in certain ways. And they may have difficulty knowing what to do with maybe unstructured time at work, like lunch breaks and so on. Help the person develop a plan on how to approach coworkers. You may also be able to help someone manage boundary issues or interpreting interpersonal cues from bosses and coworkers. Role plays are particularly useful to help prepare for potentially difficult or stressful interpersonal situations. Helping someone to develop problem solving and communication skills is certainly beneficial in the person's first entry into employment, as well as on their career path. Clinical providers can really help facilitate interactions with supports and social networks, whether that's on the job or off the job. And we also, as providers, want to be aware of any attitudes, beliefs, and expectations of the person's family or social network. For example, do family members embrace the idea of work? If not, maybe have some discussions with family members about why not. Family support could be critical to the person maintaining and achieving employment. Providers can discuss the changing family relationships and expectations and help facilitate family meetings to possibly deal with any of these issues. The family dynamics may change when the person goes back to work, and a clinical or non-vocational provider can really help to facilitate support in that area and possibly facilitate meetings and encourage the individual to address this with their family or friends. Finally, providers can help support an individual's long-term career efforts by remaining positive. A first job is unlikely to be the perfect match. Think about your own first jobs. Probably not likely they were a perfect match. I know for me, it certainly wasn't. Help the person deal with discouragement of unsatisfactory job endings. Help the person frame work experiences as learning experiences. Everyone wants jobs that use their strengths and supports their lives and health over time. Connect these to where the person's interests are, and help that person really understand that job terminations, or if it's not a good fit and the person decides to leave the job, explore with the person what they may have learned. What are some of the values that they identified for their own future career planning that may be helpful? But again, remaining positive and helping the person better understand that this isn't an end, this is only a growth and something to learn from if it ends in, if the job ends. So let's look at a team approach to readiness development. And when we talk about readiness, again, we're talking about as a team, how to help someone resolve ambivalence in those areas of felt need, their commitment to the desired goal, which in this case is a career goal, school or work, what they know about themselves as a worker, and what do they know about the world of work or school. So regardless of your job on the team, you may want to consider these questions as they relate to our role or your specific role. We're going to look at and sample recovery plan that highlights various team roles and what their contribution to a vocational goal might be. But let's look through these just very quickly. How can I support a person served in increasing their need to change or their belief that a career is possible and positive? How can I support a person in developing a greater knowledge of themselves as worker or student? And finally, how can I support a person in developing greater knowledge of the world of work or school? So think about, and maybe even in a team meeting, consider these questions as you are working through how, as a team, you can support someone to develop readiness and to help to diminish ambivalence around employment or education goals. So this is just a sample plan demonstrating a variety of team roles. As you can see, Nelson's overall long-term career goal is to become employed as a banquet server at a catering hall by December 2020. So as you can see, some of the work has already been done by Nelson. He has a short-term goal of completing the credentials necessary to qualify for a job as a banquet server, and his plan was to do this by September 2020. And if you look on the objectives here on the left, Nelson will pass the HSE exam, which is an exam specific for servers. And if you notice the highlighted or the bolded team members, the clinician, vocational specialist, and Nelson will all identify strategies to help with managing external distractions while learning. Nelson and the clinical team member and vocational specialist previously met, identified that there were some barriers, and one of those barriers for Nelson to learn adequately was managing external distractions. So as a team, the three of them were going to have a discussion and have that done by May 5th. So if you continue to look through, there are a variety of different roles on the team listed. This is to illustrate how all team members can really be an important element in helping Nelson and others in their pursuit of career goals. The last bullet under the first objective, Nelson and the peer recovery specialist will meet weekly to discuss or modify wellness strategies. So we know that maintaining wellness and focusing on well-being is critical to our improved relationships on the job, or our improved even belief that we can succeed in certain tasks on the job. So having someone on the team address wellness strategies, it doesn't have to be the vocational specialist. It can be someone else who really has an expertise in that role. So you can go through many of these objectives. Again, think about how you might incorporate some of these into your own discussions with individuals on your team and with individuals that receive services. So think about one activity that you can do over the next week or two to improve integration of employment and clinical services. So take a minute to think about what that might be and think about what we reviewed. We talked about how career services play an important role in meeting clinical goals. We also talked about the idea that career goals should be part of all clinical conversations, as career goals oftentimes help someone improve clinically. Career readiness supports a person to move towards change by providing information and choice. And readiness can be developed through experience, information, and support from all team members. Here's the reference from the training. And if you have any questions, I would encourage you to feel free to contact one of us. This information will be available to you, and I appreciate the time you took in listening to this module. Thank you.